Good evening. Welcome to the Diabetes Reversal webinar. If you can hear me and see me clearly, I just want you to say hello in the chat section. Just say hello while we wait for some other people to join in for a couple of minutes and then we begin. Hello, Rita. Good evening. It's good to have you here. Hello, Khalida. Good evening. Hello, Fumi. Hello, Kemi. It's good to have all of you here this evening. Remember, you can share links with anyone that you know that needs to be here. We still have a couple of minutes before we have our experts come up and begin to talk about the seminar and everything that we have planned for you this evening. So you can take the next couple of minutes to just do that, even as we continue to say hello. Hello, Eneni, pardon me. Hello, Menopause Society, Menopause Support Initiative. It's good to have everybody here. So you can check your emails or you can check the text messages that you received for the link. That is the link that you share for other people to be able to join in the webinar this evening. So just go ahead and do that. And if you're just joining us, I would like to know you can hear and see me clearly. So just kindly put a hello in the chat section again. Hello, Grace. Hello, Tesla. Good evening. You're very welcome. We'll be starting in a couple of minutes. And as I mentioned earlier, please feel free to share the link with anyone that you know needs to be here, anybody that you know would benefit from this knowledge. All right. So make sure that you're doing that actively. If you've invited a friend, you should be reminding them at this point. Good evening, Gloria. It's nice to meet all of you. Welcome, welcome again. We have just 1 or 2 more minutes before we go live. Hello, once again. Good evening, Bumi. Thank you so much for joining us. Good evening, Chooks. It's good to have everyone here. Thank you all so much for taking your time on this lovely but hot Sunday evening to join us for this webinar. Um, I know that it's going to give you a lot of information that you need concerning diabetes and the reversal. I also understand that quite a number of people aren't completely clear on what the diabetes reversal means and how it works, but that is exactly why we have organized this webinar for you. So I'm going to need you to pay attention, take down questions. Like I mentioned earlier, we'll be having experts coming up to talk about diabetes and everything that you need to know. And even as the live goes on, please still feel free to send reminders and send the link to as many people as you know should be here and would benefit from this. All right, so we're just going to go ahead and start. Good evening once again. My name is Lois Samari from Wellahealth Technologies, and we're starting the diabetes reversal webinar this evening. It's so good to have everyone here. And I want to give you just a little bit of information on the company organizing this, as well as what Meditrina is. I know that a lot of you heard this from different ads from the Meditrina page, either on Facebook or somewhere else or another social media platform. And so, first of all, Wellahealth Technologies is a health tech company that specializes in making sure that affordable and quality healthcare is available for Nigerians, is accessible to all Nigerians everywhere. And we have quite a number of products that do this, right? And one of those products is Meditrina. Meditrina, I'm sure you've heard the name before. And if you haven't, I'm glad to be introducing it to you. So, what is Meditrina? Meditrina is a patient support system that specializes in making sure that people managing hypertension and diabetes have 24/7 care to help them manage these conditions. And the way that it works is very simple. It works on WhatsApp. And so you have a couple of features that are made available to you completely free to make sure that you can keep track and help you throughout your journey. So if you're on the Mediterranean platform, like I know some of us already are, some of the things that you enjoy are: one, you have access to a doctor. So you can request to speak to a doctor if you have any concerns about your condition, hypertension and diabetes, like I mentioned earlier. We also have a feature that reminds you to check your blood pressure and your blood sugar levels. If you have been to a medical professional recently or healthcare professional, they would always stress the importance of making sure that you can check your blood pressure, making sure you can check your blood sugar level. And not just when you go to the clinic or when you go to the hospital, but it's important for you to do this consistently. And so Medicina helps you to do that consistently and to also record your readings so that you're not writing it on a piece of paper and forgetting it somewhere. You can do all of that on the Meditrina platform. We occasionally have people calling in to make sure that you're fine, checking up on you, and to see that you are able to follow up with everything that you need to concerning your health. We share a lot of information concerning hypertension, diabetes, how to manage, how to live a good lifestyle, including your diet and a lot of other things surrounding that. We also have this feature where you can request a test. Now, I know not everyone is able to have a blood pressure or a blood sugar monitor anywhere that you are. Maybe you have at home, but when you travel, it's also not possible for you to get your test done. Now, Meditrina would connect you to a pharmacy that is close to you so that you are able to do this anywhere that you are in the country. So, those are just some of the features that we have. And because we focus on hypertension and diabetes, that is exactly why we're bringing this webinar to you, diabetes reversal webinar. But I won't speak too much on that. Very soon we're going to be having a doctor and a dietitian, a registered dietitian, coming up and taking some time to explain what really diabetes is and exactly how the reversal works. We know that a lot of people here may be managing those conditions, but you may not fully understand what it means and how you are to go about it. But the professionals are here, the experts are here to take you through everything this evening. So I want you to sit back, relax, and pay attention as much as you can. I'll just give us 1 or 2 more minutes to still send this link to anyone that you know that needs to be here. So look through your contact list, send it to your church members, send it to your family, friends. This webinar is completely free. Once they click on the link, it opens up on their YouTube, they join in. That's all that they need to do. So we have 1 or 2 more minutes just to make sure that we can have them join in, and then we continue. Can we hear me now? Sorry about that. I think my network hung for a second. Can we hear me now? I'll need to see that in the chat section to continue. Okay, wonderful, wonderful. I also advise you to click on the channel that is Wellahealth channel where you are viewing us from, and to subscribe. Just in case we have any network glitches, we would need to restart the live, and the old link may not work. So if you go to the channel, or if you're subscribed to the channel, you would be able to join. So the Wella Health channel, I want everybody to just subscribe to that channel so that you don't lose the live, or in case we have any glitch, you can still join in once we restart. So please let everyone do that. Okay, have we all been able to follow subscribe to Wellahealth channel? Okay, our guests seem to be having an issue joining this live. Um, so what I'm going to do now is I'm going to end this and then I'm going to start another one. We'll also resend that link. But like I mentioned, just immediately join, or if you subscribe to Wella Health's channel, you can see the link immediately and join. I will be done well before 7 to make sure that um Muslims are able to go and break their fast and do all that they need to. So I'll be ending this live. Please just in the next 2 minutes, just join in again to the next live. Thank you. Okay. Good evening, Doc. Hello, everyone. Can you still hear us? If you can still hear us, just type in the comment section. Okay, wonderful. Wonderful. Good evening, Doc. Can you still hear me?
Yes, I can hear you. Can you hear me?
Loud and clear. All right, so we'll be going ahead, and like I mentioned, we'll be having a doctor and a dietitian speaking to us really quickly. So here is Dr. Amaka going to be telling us a lot from the medical aspect as to everything that pertains to diabetes. Doc, the floor is yours.
Okay. Good evening, everyone. Trust we are doing okay. So today we are here to discuss about diabetes. Diabetes is an old illness. It started since everyone knows about it. Now, what is diabetes? Now, diabetes is a chronic medical condition that is characterized by constant elevation of blood glucose or blood sugar in the blood. that will now cause the complications in the heart and other body organs. Now, what are the prevalence? The For the prevalence, we have to go to the types of diabetes. You see it more from people that are from 40 years and above, although you can still see it in the adolescent age. Now, here, there is insulin resistance. Insulin is produced quite alright, but the receptors it normally binds to draw glucose into the cell. There is resistance there. So here, insulin is produced in a little quantity. Now we also have the potentially reversible types, like the gestational diabetes that is seen only in pregnant women. After pregnancy, everything goes back to normal. Then pre-diabetes. Here there is elevated blood glucose in the blood, but it is not to that amount that can be called type 2 diabetes. Now, why are we discussing about diabetes? What is the impact? We need to talk about it because diabetes is a disease that reduces the quality of life. Diabetes is a disease you manage every day. You take these drugs every day. The complication can cost reduction in finances, it can lead to loss of life. So we need to talk about diabetes. Also, the diabetic emergencies. One can die within 3 or 4 hours if the person have the ketoacidosis and the hyperosmolar hyperglycemic state. That's why we need to discuss diabetes. It causes this reduced health span. Some people that have had this disease for over 15 years or 10 years, they get worn out from having to take these drugs every day. So that can lead to depression. Some complication of diabetes may involve decreased sex life, low libido. Now, when this problem occurs, especially in young marriages, there is a problem. Then the other complication that we will talk about later. So, what are the symptoms? The common symptoms is the three P's: polydipsia, polyphagia, and polyuria. In polyuria now, this person produces large quantity of urine, and the mechanism that brings about this polyuria is that increased glucose now normally in the kidney, every good stuff, solutes, nutrients is reabsorbed at the kidney level. Now, when this glucose piles up in the kidney, it overwhelms it. So now glucose is excreted in the urine. Now, glucose is highly osmotic, like it's a solid that draws water out. So while glucose is being released into urine, it draws water into it. So that is why you see this individual passing out large quantity of urine. Now, really reducing the blood volume now through this mechanism where water is being released, it causes dehydration. Now, this dehydration now will now make the blood to be hyperosmolar. There is reduced water in the blood, so everywhere is now so is kind of is hyperosmolar now. Now, this state now for the body, the normal body to function, the body cannot, the low blood volume, the body cannot function at that level. It's going to the brain now will signal the hypothalamic center to activate the test mechanism. Now, this individual is going to be drinking so much water, and that is called polydipsia. So, polyuria, polydipsia. Now, what about polyphagia? Now, as we all know that hyperglycemia, that glucose is stocked in the blood. So, the normally glucose, normally the glucose is the major fuel the brain utilizes, other muscles, every organ utilizes mainly glucose. Now, because glucose is trapped in the blood, these organs that need it for action, they don't have it. So the body will have to function. So it will go to the other mechanism to draw ATP, to draw the glucose. And that mechanism is through proteolysis, breakdown of protein, and lipolysis, breakdown of lipids. Now, when this protein is being broken down, it causes albumin to be released. So you have the hyperalbuminuria in the urine. Now, this is that stage that can cause the weight loss that is being seen. And the other mechanism will trigger food. You are breaking down protein, your muscle is breaking down the protein, so your body will want to replace it, so you will be eating. So that is the polyphagia. So the polyphagia, the polydipsia, the polyuria, and the weight loss, these are the major symptoms you see in diabetes. Now, how do we diagnose it? So normally, commonly, the one everyone knows is the fasting blood sugar. Here you can do it with a glucometer. It's very easy to do. You must have fasted for over 6 hours. We normally use the overnight fast. Let's say you stop eating around 10 p.m. and you are at the hospital by 8 a.m. to check it. So it should be more than 126 milligram per DL. Now, another test is the random blood glucose test. Now, you come in at any time, and if it is above 200, above or equals to 200, you are likely to be diabetic. Now, the other test is the 2 hours OGT test, oral glucose tolerance test. You come to the hospital, you are being given a food that is high in sugar. You take it after 2 hours. If it is above 200, you have diabetes. But the main diagnostic test is the glycated hemoglobin test, HbA1c. And if it is above 6.5%, you have diabetes. So now let's talk about the complication. We have the acute complication. They are being called diabetic crisis. And then we have the long-term complication, the complication that comes around maybe 5 years, 10 years, or if you are managing it so poorly, you will get this long-term complication early. So let's talk about the diabetic crisis first. Now is the diabetic ketoacidosis and the hyperosmolar hyperglycemic state. Now, some of us have friends or have siblings or relations we know that you heard that they went to the hospital and the sugar was so high within 4 hours or so, the patient lost their lives. Now it's due to these diabetic emergencies. Now let's talk about the diabetic ketoacidosis. Now, hyperglycemia now. Sugar is being pulled up, glucose is being pulled up in the blood. The body have to function. So they will have to look for alternate source of energy. And that is through breakdown of fats and breakdown of protein. Now, during this breakdown of fats, now, when fat is broken down, you form the fatty acid and glycerol. Now, this thing will lead to the production of acetyl-CoA. Now, when this acetyl-CoA piles up in the blood, it forms keto bodies. Now, is these keto bodies, when they are so much, they raises the acidosis, the metabolic acidosis of the blood, and then you can have the diabetic ketoacidosis. Now, what are the main features you see here? Even for the HHS and the diabetic ketoacidosis, this condition causes a depletion of potassium. They draw potassium out of the body. Now, this condition, like this, for people that have diabetic ketoacidosis, you see them coming into the emergency room with blood sugar as high as 250 to 300 milligram per DL. This is what they come in with. They have this cosmal respiration because the pH is so low. They're trying to breathe in fast to be able to maintain the pH. And then they have this fruity breaths because of the acetone. So this is for the diabetic ketoacidosis. Now, what of the HHS state, the hyperosmolar hyperglycemic state? Now, here, this patient, they come in with blood glucose of over 600. Yes, over 600 milligram per dl. That is too much, yes, but that is what they come in with. Now, there is still depletion of potassium, because it draws out potassium from the cells. And these people here now, there is dehydration. The hyperosmolar state of the blood is also so high. Now, these people, they come in, sometimes they come in comatose. They don't know what they are doing. Their mental state is deranged. So they are fatigued and everything. They come in with blood sugar level of over 600. Now, sometimes when this is not managed very, very well, now because of all those mechanisms, it's very easy for them to lose their life. Like I have seen during my internship in Nnamdi Azikiwe University, Nnewi. I know a man that we managed this so well. At some point, he got better. He went home. Now that emergency occurred again. He was brought in dead, BID. So that is how bad this diabetic crisis can be. Now let's talk about the long-term complication. These complications, they don't come as emergency. They happen over time, over 5 years, 2 years, depending on how this individual is taking care of him or herself. Now, what is the root cause of this long-term complication? This blood, everything falls back to the hyperglycemia. This blood pulling up, this sugar pulling up in the blood. And there is decreased glucose for the other body, for the body organ to work with. So through the process of gluconeogenesis, which is the breakdown of fat and protein, and also glycogenolysis. Here also, apart from apart from us getting this glucose from the Krebs cycle through the breakdown of carbohydrate, protein, and fat that we eat, the glucose also have a store of the liver also have a store of glucose. That's why some people will say, after fasting, my blood, I didn't eat anything. I still check, and my blood glucose was high. Yeah, you will be asking, so where is the body getting that glucose from? It's getting it from the liver through the process of glycogenolysis. So that is why once you've been diagnosed to have diabetes, you work with a dietitian. So you no longer do something like you normally do. No, your body now at that point is no longer as it used to be. So you have to work with a dietitian. You don't have to fast to cure diabetes. No, no, there is an underground cause. So whether you fast or you don't fast, the sugar, your blood glucose will be high. So now let's go to the complication proper. Now, all this process causes the non-enzymatic glycation. Now, this process of getting glucose from this source, getting non-glymatic, sorry, non-glycatic, whew, okay. So now, this this mechanism now will now cause this increased binding of to sugar, to fat, to protein, will cause the blood vessels now will start thickening. The hyaline membrane, and also the all the blood vessels will be taken. The down cause is that it will cause atherosclerosis. Now, this is for the macrovascular, the macrovascular complication. Macro is something that is very big. Yes. So this non-enzymatic glycation now will cause increased binding of glucose to either fat, to either protein. In a long term, it will cause this deposition of fatty plaques on the blood vessel. Now, when the blood vessel supplying the brain, when the blood vessel supplying the brain is being occluded with these fatty plaques, it will reduce the quantity of blood the brain receives. And over time, it can lead to stroke. Now, what if it occurs in the heart? The blood supply to the heart is the coronary vessels. So if you start blocking these coronary vessels, blocking them, reducing the blood supply to the heart, it can cause coronary vascular disease and myocardial infarction. Now, all these things, the one that will lead to stroke. Some people, you've seen some people that they will just have a stroke, they will die. Or people that have the myocardial infarction, they have cardiac arrest and they die. Now, another organ that suffers from this macro macrovascular complication is the peripheral vessels. Now, these vessels supply the extremities, the legs. Now, this person will suffer. It will these fats, these atherosclerotic plaques, will deposit on the vessels supplying the legs. It will cause peripheral vascular diseases, and there will be claudication. Now, this person can suffer an ulcer. Now, if you suffer an ulcer now, normally it should heal. Whenever you have a wound, it should heal. But the increased glucose in the blood will reduce the healing. Now, this ulcer can go to the stages of all those Wagner's classification. It can lead to gangrenous foot ulcer, and this leg can be amputated. Now, what about the microvascular complication? Now, we see it mainly in the kidneys. Now, these glomeruli that works in the kidney, these plaques now is going to deposit in these small vessels, small vessels. With time, it won't be able to reabsorb albumin. Now, you see, albumin will be found in the urine, and this can cause this CKD, and also the nephrons. The nephrons are like the powerhouse of the kidney. It will be destroying them. They will be undergoing cellular death, and this can lead to the CKD. Now, for these people now, it doesn't just go move to chronic kidney disease just like that. No. Now, when you do this test, you come for people that come for normal do checkup, maybe 3 monthly checkup, 6 monthly checkup, you notice that your EGFR is now high. You know, that is the progression it does till it get to that end stage kidney disease. Now, another this thing that for the
Um, Hello, can everyone hear me? Seems like Doc got cut off. Okay, so like I mentioned earlier, if you have any questions for Doctor, I know she mentioned a lot of things concerning diabetes, and I see a lot of questions, right? But she may not be able to take all of them because of time. However, we'll send a link for Meditrina so you can join in for free. You can request to chat a doctor, and all your questions will be answered by medical doctors who have the understanding and are able to answer the questions that you have. We will just call up the dietitian. So this is registered dietitian Tito Ipemoye, and she's going to be joining us now. Um, I don't know if she has joined in, but once again, the Meditrina number would be sent out. The link would be sent out. So anyone that has more questions, I see about 2 or 3 people have dropped their questions. So be patient. You'll be able to ask those questions and take your time. Even much more time than we have for this webinar. Okay, wonderful. She's here. Hello, Tito. Good evening.
Hi, good evening. It's nice to see
How are
you.
you doing?
Fine, thank
Nice to see
you.
you too. Can everyone hear us loud and clear? The floor is yours. Please go ahead.
Oh, hi everyone. My name is Tidre Kumoye and I am the lead dietitian here at Meditrina Clinic. So it means that if you live in Lagos, Nigeria, like I do, and you have a reason to come to clinic or you have a reason to sign up, you would most likely be working with me at our diabetes reversal clinic. So I'm just here to say I know that a lot of people have questions about diabetes reversal. First question I get is diabetes actually reversible? And the answer is yes. And I have worked with over 5,000 patients across Africa. So a little background, I have 6 years practice as a clinical dietitian and 4 years focusing on diabetes management. And so I have partnered to work with Meditrina Clinic to ensure that we help more Nigerians, manage their diabetes and even reverse it. So gone are the days when diabetes was a death sentence, oh, I have diabetes, I'm eating only on ripe plantain and beans. The good thing is when you work with us at Meditrina Clinic, you can eat absolutely anything. And I know that we've gone on radio a couple of times to talk about our clinic, and people cannot even believe it. They'll be like, you say we can eat absolutely everything. And I say, yes. I will give a practical example I always give was when 2019, I used to work with one of these very popular government hospitals. And I remember that I saw a 65-year-old man who had been diabetic for about 15 years, 15 years. And I asked him, okay, Papa, what have you been eating in 15 years? He said, that he has been eating only on ripe plantain and beans for 15 years, only on ripe plantain and beans. And as soon as I told him, Papa, you can eat absolutely anything, he started to cry, you know. And we were able to work with him. For someone who has been on drugs for 15 years, we're able to effectively help him manage his diabetes, and we were able to take him off drugs. And I know that a lot of people have also given that, testimony to say that I just changed my diet and I just changed my lifestyle and I was able to reverse diabetes. Now, the problem is that a lot of people do not have access to this information. When you come on social media, there's so many information around diabetes management. People don't know what to do, people don't know exactly who to talk to, and that's why we are here for you. At the Meditrina Clinic, with me being the lead dietitian at the clinic, we have tools in place to ensure that not only are you eating your food, you're also enjoying the meals that you want to eat. So gone are the days where they'll say, I have diabetes, so I don't eat wheat, I don't eat rice, I don't eat beans, you can eat absolutely anything. Like, what we do, we are not doing it, devoid of your doctors. In fact, when you come to clinic, the first thing we do for you is we write you a proper medical detailed note to say that your primary physician needs to be aware of what you're doing. Because again, I have seen a lot of people do abracadabra. So practical example I would always give, there was a day in the clinic where somebody came, he said he drank bitter leaf juice, trying to crash his blood sugar. People have all kinds. So you don't have to drink bitter leaf juice to crash your blood sugar. You don't have to even drink herbs. You don't have to do any of that, with just your diet. Because at the end of the day, think about how much you spend on drugs every other month. How many drugs. And the annoying thing is, the more you use the drugs, the more your drugs, the more, your drug dosage are increased. However, for your diet, you eat every day. You eat every day. You have to eat every day. You don't have to use drugs every day, but you have to eat every day because the diet is part of our lifestyle. And so how about we help you, work with this your diet to ensure that you are able to reverse your diabetes. And guess what? It's just 12,000 naira. And that's very 12,000 naira for 12 weeks, and you are able to reverse your diabetes in 12 weeks. Calculate how much you have spent on drugs in the last 1 month, in the last 2 months. And I'm saying that with just 12,000 naira, you can either come to the clinic, and we have clinics in Lagos, we have in Abuja, we have in Uyo. And for people that are not in all of these places, you can also speak to me virtually. All you need to do is just book a session for just 12,000 naira, and you have access to this wonderful thing that we are selling. Because at the end of the day, we talk about how diabetes is inherited, how it is genetic. And me, I do not agree. I tell people that it is the lifestyle that is inherited. If your mother, your father had diabetes, and you are also doing the same thing that they did, you would also have diabetes. So it is not even only for people, that are struggling to manage diabetes. It is also for people who know that they are predisposed. So if somebody in your family has had diabetes, your mother, your father, and you just want to be sure that, please, so me too, I want to be on a safe path, you have to come to talk to us at Meditrina. Like I said, we are not doing any abracadabra. We're not selling you any supplements. We're not selling you any herbs. We are working with you, with your primary doctor, and with your regular diet. So other questions will be like, and the food that you used to give us, is it something that we can find? Yes. We build your menu plan according to what is obtainable in your local market. So if you live in the north, right, we will draw a menu plan for you based on what is obtainable in the north. If you live in Lagos, it is what you can find in your local market. Because another thing that I tell people is, any diet that does not allow you enjoy the foods that are available in your local market. If you cannot go to a Bariga market or Wuse market, or one market that is just down your road and buy the food ingredients, and you only have to go to one of these big malls, and then you will see 25,000, 30,000, you have no business eating it. And so that's one of the things that we offer, with this diabetes reversal program in 12 weeks. 12 weeks is just 3 months. So, and in 12 weeks, we are able to help you reverse your diabetes properly to ensure that you do not have to take any more drugs. Now, like I said, we are going to be working closely with your doctor and not doing any abracadabra. When we start the program, we will send your doctor a note explaining exactly what this program is about, so that when it is time for your doctor to take you off your drugs, your doctor is not hesitant, because your doctor knows that you have worked with registered dietitian. So I don't know if anybody has questions for me, but like I said, with diet management and diabetes, we are your go-to guys. And I would say for the next 12 weeks, once you sign up, we become your best friends. You have me, as your best friend if you are in Lagos or if you are in my clinic. And we would also ensure that you enjoy all. So I hear people say, oh, I go to a party and I do not I'm not enjoying, I can't eat because I have diabetes. No, if you work with us in Meditrina, even if you go to UK, even if you go to Canada tomorrow, it is not going to disrupt the program. Somebody said the 12K is for what, please? It's for the program, the entire 12 weeks, the diabetes reversal program. And that is very affordable. 12,000 naira to get, and you have access to me and other dietitians that work in our team. You have access to personalized meal plans, and then you have access to follow-up sessions for a period of 12 weeks. And somebody is asking, please, what of type 1 diabetes? Yes. The unfortunate thing is, because type 1 diabetes is a autoimmune disease, and so we can there's really, it is not reversible. However, we can ensure that it is properly managed, and the person that is has type 1 diabetes is not even feeling it at all, and you're not heavily reliant on on drugs. And that's usually the problem for type 1 diabetes. You're heavily reliant on insulin and heavily reliant on your drugs, but with accurate diet, we are able to help you manage your condition properly. Somebody is asking, what does this plan entail? Like I said, you have access to registered dietitians like myself, who have worked with over 5,000 diabetes patients across Africa, helping over 80% of that number to effectively manage, their diabetes. You also have access to customized meal plans, personalized. So, for example, some people say, you cannot eat by a so time. I used to say that for those of us that live in Lagos, by 6 o'clock, I am still inside traffic. So how would you tell me that, once it's 6 o'clock, you cannot eat again? And I will say, by that, when I get home by 8 o'clock, I am still very hungry. We would plan a meal plan according to your lifestyle, so that whatever you can eat and you're not feeling out of place. Another problem that we have with people managing diabetes is that they always feel left out from the family. So everybody's eating A, they are forced to eat B. So some people say, oh, we can eat only wheat, we're only allowed to eat. No, it's not true. With the meal plan we are going to give you at the Meditrina clinic, it is for the entire family. Like I said, one person has diabetes in the family, there's a very huge likelihood that other people in the family are also living that particular lifestyle that will make them predisposed to this illness. So it is very important for everybody to be a part of the program. And so we give meal plans, not the one that daddy is eating a different thing, mom is eating a different thing, the children are eating, something that is totally different. Everybody is a part of the plan. And so, someone says, I am here for my younger sister who is only 29 and has been suffering from diabetes for almost 3 years now. No one, yes, it is possible. Diabetes will be acquired. There are so many things that people start to delay. If you have diabetes or somebody managing diabetes, we spend more than 12,000 naira every other day on food, on transportation, and we are saying that with 12,000 naira, we are able to help you effectively reduce the cost of drug management. Now, what are the simple things you're going to enjoy with your in this program while you manage diabetes? Number one, you would have
I can hear you, Tito. If you can hear her, please put it in the chat section. I can hear you, Tito. Can you hear me? Um, if anyone can hear us, please
can you
just put
hear
that in the
me?
chat section so that we know.
I don't know if you can hear me, or can you hear me? Okay. I think my network. Yes, I think my network just went. I think my net. I think my network went off. Okay, so like I was saying that some the three important things that vegetables do in your diet. Number one, it binds with the sugar that whatever you eat. Again, carbohydrate is sugar, like we all know, and so people are so scared of eating carbohydrates. People will tell you, "Oh, I don't want to eat carbs." The beautiful thing is, carbs is the primary source of fuel that your body live in Africa. Right? And so you cannot even remove that from your diet. And so what is important is to find out how we can manipulate these carbs and ensure that it is in your diet and you are able to enjoy, your food. Also, diabetes, sorry, and draw out the sugar from your intestine at the point of absorption. It would help you remove some of the sugar from your diet. Also, because fat also disturbs the function of insulin, the vegetables will also help to remove some of this fat from going into your bloodstream. And thirdly, it will keep you fuller quickly. So one of the things that we would also do is something we call portion control. And so if you're going to do portion control, it means that we're going to reduce some portion of these carbs that you would eat. And so if we're removing some of the carbs, we would have to put something else, to augment for what we have removed. And that is why it is not just something that it is not what works for Mr. A might not work for Mr. B, and definitely does not work for Mr. C. And so when it comes to management of diabetes, it's not a one size fits all. And that is why you have to come to Meditrina Clinic. I see people say, oh, 12,000 naira, can we reduce it? But think of how much you actually spend on drugs. Think of how much you spend. And we are saying that 12,000 naira is just 1,000 naira per week. And we are going to help you reverse your diabetes in 12 weeks. So, I mean, we are already doing our best because we love you. I have a passion for diabetes because when as a young dietitian, when I started my career in the National Hospital in Abuja, they will say somebody died of diabetes. I say, eh? They say, they've cut somebody's leg. I say, in the name of diabetes that is so easy to control. I did not used to understand it because I know how easy it is to manage diabetes. But I also came to realize that people do not have the right kind of information. And that's why, because a lot of times you go to the hospital, the doctor will not refer you to a dietitian. The doctor will just say, stop eating this one. And then every time you come back after 3 months, your blood sugar is still very high. Then they put you on more drugs and more drugs and more drugs and more drugs. And then one day you just say, I beg, something has to kill a man. I cannot stress. Or these drugs are too expensive. Please, 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 please. And so I would advise 1,000 naira per week. Just close your eyes. And it is, we know that the economy is hard, but what we are offering you is lifetime freedom. Lifetime freedom from this diabetes, lifetime freedom. And so it is very important. Come to clinic. If you are in Lagos, come and talk to me. I am very passionate about this subject, diabetes. We would, for the next 12 weeks, I am your best friend. If you go to a party and they serve you food and you are not sure, snap the food and send to me and say, dietitian, can I eat this food? And I will tell you, okay, why not, let's do this, let's reduce this, let's add to this, let's do this and that. And that is why I'm here. That is why I'm here for you. I am here because, I'm here because I want to help you. Nigeria has to, diabetes is too easy to manage. It's too easy to manage for people, not to be, for people to be dying and people to get amputated and people to be spending so much money trying to, spend on drugs. Now we have three locations. We have two locations in Lagos, in Lekki and Ikeja. We have a location in Abuja and we have a location in Uyo. However, if you are not in any of these three places, I would also be available to speak to you online. The way we are talking now, we would have an online session. In fact, which is what I would always advocate, from anywhere around the world. So if you know someone that is in UK or US or in Canada, just ask them to book a session with me. Let's talk about it and let us help them, manage their diabetes. Our location in Ikeja is Adeniyi Jones, but you have to book a session. Our sessions on the mainland is usually on Tuesdays and on the island is on Wednesdays. However, because we are heavily booked, again, we are looking for just a number of people. Like this program is very, very, very discounted. Is very discounted. And so we don't want more than 100 people. So it is very heavily discounted. So we don't want more than, I don't have capacity to talk to more than 100 people. So we have 49 people on this call now. And I want to ensure that 49 people, everybody signs up today, not tomorrow. Just 12,000 naira, because again, we are just running this program for 4 months. And so if you want to be a part of it, quickly ensure that you sign up today, and so that I'm able to help you. We're in Adeniyi Jones. Please, once you register, I am sure that I think it's 86A Adeniyi. I can't remember. I'm not very good with address. That's in this Lagos. I'm not very good. However, once you make your payment and you book a time, again, you cannot just walk into clinic. We usually have heavy bookings. We are always very, 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 very booked. And so it is important that you book a time, because I am booked from 9 a.m. to 5 every day. So how do you register? I'm sure that Lois will give details of how to register. So again, we have clinics in Lekki, we have clinics in Ikeja, we have clinics in Abuja, and Uyo. Of these places, please make sure you register online. Again, this program is only open to 100 people, and on this call, we have 49 people. And we are one of the privileged few that have access to quickly sign up before it closes. Our slots are very limited, and you have to book a session. You can't just walk in. It is important that you book a session to be part of this. All right. Like details of how people can register.
All right, thank you so much, Tito, for all the information you've given us. So, someone was sending the number to the chat section, but I'm going to call out the number now. So, I want you to take it down. This is the number that you use to register for this clinic, right? So, this is pretty much the most important number in this entire conversation. It is 09082 100 211. I'll keep saying it again and again. 09082 100 211. I'll say it again. 09082 100 211. Remember, you're sending a WhatsApp message to this number. All right, so just save it as Meditrina or however you're going to be able to remember it. As soon as you send hi on WhatsApp, it would give you some information as how to proceed for this. Remember, there are limited slots, so I will say the number one more time. All right. So let's take it again. 09082 100 211. One more time. 09082 100 211. If you missed that, just type in the comment section. All right. And I'll repeat it once again. Um, so for your sessions, please make sure that you are available. You can either pick a physical session, but if you know you're not able to make it, just pick virtual. I think that would be the easiest way, so you don't have to miss out on anything. Anywhere that you are, you'll be able to speak to Tito, and she'll give you all the information. It's just as valuable as going physically. But if you can't make it physically, I encourage you to do so. Have your physical session so that you'll be able to, speak to Tito one on one and get all that you need. So one more time, I know that a lot of people are going to be dropping off. The number again is 09082 100 211. If you didn't get the number, just put it in the chat section. I would say the number again and again. Remember, without this number, you are not able to get the session. So for when you need to pay for the session, just chat that number up and it will link you up to when and how you need to pay for your session. Remember, it's just 12,000 naira for a whole 12 weeks for you to reverse diabetes. This is a steal with limited slots. So make sure that you're taking advantage of it. The number again, 09082 100 211. No, you pay for all the sessions at once. I'm answering the person in the comment section. So it's a one-time payment, all right? It's a one-time payment that you make. It's not in installments. Remember, this is 12,000 naira. If you go outside of Meditrina, yeah, you know how much you're going to be paying. So this is a very good deal for you. I need you to take advantage of it. Just pay it once. Do your best. I know that with everything going on, it may not be so easy, but for your health, it would benefit you in the long run and not just for right now. So that's what you need to be thinking about. Yes, if you're a pregnant woman, that's amazing. Or if you know someone that is pregnant, they can also sign up for the clinic. At People of any age can sign up for the clinic as long as you're able to register with the WhatsApp number. Once again, the number is 09082 100 211. 09082 100 211. And if you still have questions, for the doctor or the dietitian, that number that I just gave is the same number you need to reach out to. You can talk to a doctor for free on Meditrina, or you can sign up for the 12-week program and have Tito give you everything that you need to know that will work for you. If you're in Ibadan, you can sign up for this program. You will just have your chats virtually. That means you and Tito can talk over the phone, right? You'll be able to text her, you'll be able to do a video call with her just the way that you can see her right now. So your location in Nigeria doesn't matter, and it is not a hindrance for you taking part of this wonderful deal. Once again, the number is 090 82 100 211. 82 100 211. Tito, I don't know if you have any other thing to add.
Oh no, I don't. Except I hope to see all of you in clinic. For everybody pregnant, non-pregnant, Ibadan, Abuja, UK, US, anywhere you are around the world. I am here to answer every question and hold your hands on this journey. It's a step-by-step journey. It's a gradual process. But yes, I am here to work with you. So, like she said, all you need to do is text hi on WhatsApp, and we are here to book your session virtually or physically, because we care so much about you. And no, diabetes is not a death sentence. It's not a sentence to boring life of endless swallowing of drugs and terrible diets. We are here to ensure that we make you happy and you live well, and that's why we are here. Thank you very much.
Thank you so much, Tito. So people are asking how to register. This is how you register, all right? I don't know if the link is showing in the chat, but if it is not, pay attention, right? I will call a number. Please save this number on your phone and then go to your WhatsApp and find this number and text hi. It will give you all the information that you need to sign up for the clinic. So pay attention. The number that you text on WhatsApp is 09082 100 211. I'll call it again and again one more time. 09082 100 211. If you want to register for this, which everybody on this call should be doing immediately, this is the number to text on WhatsApp. Text it on WhatsApp. So once again, it is 09082 100 211. I believe we're going to be ending the live in about 2 or 3 minutes. I just want to make sure that everyone that has joined gets the phone number, because that's one of the most important things. You've heard from the doctor, you've heard from the registered dietitian, you know all that you need to know. And even if you have more questions, the number is the channel for you to get in, to ask your questions, and to register, most importantly, for the clinic. So the number once again is 09082 100 211. Remember, it is WhatsApp. So if you save it and you want to call it, you may not get the response that you need. It's a WhatsApp number. All right. Send a message on WhatsApp. If you don't have a WhatsApp line for whatever reason, someone else can actually register for you and still get you on the diabetes clinic, and you can continue with your program as you need it to be anywhere that you are in the world, not just in Nigeria. So once again, the number is 09082 100 211. And for the last time before we end the live, I hope there are no other questions. It is 09082 100 211, the WhatsApp number for the Diabetes Reversal Clinic. Thank you so much, Tito, for your time this evening. Thank you so much, Dr. Amaka. Um, we hope to do this again, and if there will be another webinar, we would still send you emails. So look out your emails, your text messages. You may just be getting another session of this. But nevertheless, if you still need to get on Meditrina, use that phone number and sign up for the Diabetes Reversal Clinic. Remember, it is 12,000 naira for 12 weeks, and you get wonderful health care and guidance for all that you need concerning reversing your diabetes. All right. Thank you all so much for your time this evening. I hope that you have a wonderful night rest. Um,
Bye.
Good night, everybody. Bye, Tito.
Bye.